Hi, and welcome to the Heart Health and Cardiovascular Wellness webinar. My name's Donna Penny, and I'll be joining you today for today's webinar. I'm a registered nurse and I work here at ConnectCare 3. Looking at this picture, when you look at these individuals, a couple of them have something in common. Let's take a look at what they have in common. So we have this gentleman on the left with a lipid disorder. We have a lady in the middle with hypertension, and on the far side, we have a lady who has had a previous heart attack. All of these folks have cardiovascular disease in common, and it is often referred to as a silent killer because its signs and symptoms don't always present themselves. There are several diagnoses that are associated with cardiovascular disease. They include hypertension, high cholesterol, stroke, heart failure, coronary artery disease, heart attack, also called a myocardial infarction, and abnormal heart rhythms, and also heart murmurs. So 1 out of every 3 adults aged 20 or over in the United States have high blood pressure. 95 million adults aged 20 or over in the US have total cholesterol levels greater than the recommended range. And in the United States, someone has a heart attack every 40 seconds. So let's take a look at what we're going to talk about today about cardiovascular disease. We're going to cover what it is, why it's important, the complications, who's at risk, and what is the treatment. So cardiovascular disease, what is it? Well, it's problems with your blood vessels, it's problems with your heart, and also with your heart valves. So when we're talking about blood vessels, you have hypertension and you have elevated cholesterol, and both of these things can lead to atherosclerosis, which is an accumulation of plaque in your blood vessels. And this accumulation of plaque can prevent adequate blood flow to your essential organs, such as your heart, your brain, your kidneys. Cardiovascular disease is also problems with heart rhythms. So abnormal heart rhythms can cause signs and symptoms such as palpitations, lightheadedness, dizziness, shortness of breath, and it can increase your risk for a stroke. And then problems with heart valves can actually become stenotic, meaning that they get stiff, they don't open the way they should, or they can become leaky, meaning that they open a little more than they should. And both of these problems can cause altered blood flow to your organs. And heart valves can also prolapse, meaning they collapse, and they collapse into a different chamber of your heart, and that too can alter your blood flow. So why is cardiovascular disease important? First of all, it is the #1 cause of death in the United States. So heart disease claims more lives than all cancers combined. Secondly, every 60 seconds, someone in the United States dies from a heart disease-related event. It's also important to note that it is a costly disease. It costs $320.1 billion in direct and indirect costs to take care of someone with heart disease. The important thing to remember is that it is preventable and treatable with lifestyle choices. Some of the complications associated with cardiovascular disease include an increased risk for vision loss, kidney disease, stroke, an increased risk for heart attack and heart failure, and also an increased risk for peripheral vascular disease. So there are a lot of risk factors associated with cardiovascular disease. And they fall into non-modifiable risk factors and also modifiable risk factors. Two of the non-modifiable risk factors would include your age and your family history. So the risk for a stroke, for example, will double each decade after age 55. Men tend to be at a greater risk for cardiovascular disease than premenopausal women. However, your postmenopausal women and men are at a similar risk. Race comes into play because your African or Asian ancestry are at a greater risk for developing cardiovascular disease as well. Family history is important because if you have a first-degree relative who has had a stroke before the age of 55, if you're a man, and 65, if you're a woman, that increases your risk for cardiovascular disease. Some of the other risk factors are modifiable. So when we look at the remainder of the list, we're looking at things like weight and physical activity. Obesity is a major risk factor for developing heart disease. A sedentary lifestyle, lack of exercise can increase your chances of developing cardiovascular disease by nearly 50%. Poor eating habits. A diet high in saturated fat will increase your risk of developing heart disease or stroke. Increased alcohol intake can also increase your chances too. So having type 2 diabetes makes you twice as likely as a non-diabetic to develop heart disease. Poorly controlled diabetes also puts you at an increased risk to develop heart disease at an earlier age, and the effects are more devastating. Depression and stress. So chronic stress causes the release of a hormone called cortisol. And cortisol increases your cholesterol levels, your triglycerides, your blood sugar, your blood pressure, and all of this then contributes to the development of cardiovascular disease. Pregnancy complications. If you've had hypertension or preeclampsia, gestational diabetes, or a preterm birth, all of those will increase the risk of heart disease or stroke later in life. High cholesterol, your liver actually makes all the cholesterol that your body really needs, and any excess cholesterol will actually contribute to the development of fatty deposits in your blood vessels, and then that leads to atherosclerosis. And hypertension or high blood pressure damages the inner lining of arteries, and then fat from your diet enters the bloodstream, collects at the damaged areas, and this causes the arteries to become less elastic and limits the blood flow. And smoking, nicotine is a vasoconstrictor. So what that does is it raises your heart rate and your blood pressure and can cause arrhythmias or irregular heartbeats. That puts you at a higher risk for stroke, for cardiovascular disease as well. And then poor oral hygiene. So if you don't take good care of your teeth and your gums, gum disease increases the risk of heart disease because of the bacteria in your mouth, and it can enter the bloodstream, and then it can affect the heart valves as well as the heart too. Then we have some silent risk factors that include the hypertension, which we already talked about, smoking, and high cholesterol. And nearly half of all Americans, roughly 47%, have at least one of the three silent risk factors for cardiovascular disease. So hypertension or high blood pressure, what are those numbers all about? So you have your systolic blood pressure, which is your top number, and then your diastolic blood pressure, which is your bottom number. Now, your top number or your systolic blood pressure measures how much pressure your blood exerts on the walls of your arteries when your heart beats. Your diastolic blood pressure, or that bottom number, measures how much pressure your blood exerts on the walls of your arteries when your heart is at rest in between the beats. As you get older, it is common to see an increase in your systolic blood pressure, or that top number, because of long-term buildup of plaque and an increasing stiffness of your arteries. And if you take a look here, you'll see that a normal blood pressure runs about 120 or less over 80 or less. High blood pressure is considered a systolic blood pressure of 140 or above, or a diastolic of 90 or above. So it can be one or the other. It doesn't have to be both numbers. All right, so lipid disorders, let's take a look at those. And what are those numbers? So first of all, let's talk about cholesterol. So cholesterol is a waxy, fat-like substance that is found in all of your cells, and your cells do need it to function properly. It travels throughout your body in these little packages. They're called lipoproteins. And you have two different types of lipoproteins. You have your HDL and your LDL. So your HDL is your high density lipoprotein. It is your good cholesterol, and it helps to carry cholesterol back to your liver from the other parts of your body so that it can be removed. Then you have your LDL, which is your low density lipoprotein, or your bad cholesterol. That's the one that tends to accumulate in your blood vessels. You also have something called triglycerides, and they are a specific type of fat that gets stored in your body, and it's used for energy in between meals. But excess triglycerides can also accumulate in your blood vessels. So a quick way to remember the difference between HDL and LDL. HDL is the good cholesterol, right? So it's the happy cholesterol, versus LDL, which is the bad cholesterol or the lousy cholesterol. So just a quick way to remember those. All right, so here you have the stages of atherosclerosis. Starting on the far left, you see the healthy vessel. And then as you move across, you're going to see how the lipids accumulate and continue to accumulate. And then as we get to the end here, where things are really getting kind of ugly, we've got a lot of fat development there. You've got a blood clot here. You have what we call calcification here, and that's just where things get really, really hard and compact. And as you go from healthy to having lots of plaques in the blood vessel, you have less blood flow, lots of blood flow, and as things progress, significantly less blood flow. And what ends up happening is it sets you up for a heart attack. And heart attack symptoms do vary between men and women. Sometimes women feel more like flu-like symptoms, and men tend to have more, their symptoms are more consistent with the classic symptoms of a heart attack, meaning, chest pain or pressure that radiates to the left side of the jaw, down the left arm. They get the sweating, the sweatiness, the shortness of breath, the impending doom. And that the impending doom piece sometimes can really solidify it for people. When they have that feeling, they know something's wrong. So they do reach out, they do call 911 to get the help that they need. All right, now as far as recognizing a stroke, there are certain symptoms, certain signs that somebody could be having a stroke. There is a acronym that's out there. It's called BFAST. Sometimes you'll just see it called FAST, and it is to help develop an awareness about the signs and the symptoms of a stroke. It is best to get medical attention within an hour of developing any of the symptoms. Oftentimes, a stroke will present on just one side of the body, and like you might just have right-sided facial droop and right-sided arm weakness. So taking a look at the BFAST acronym, when you're talking or interacting with somebody who you think might be having a stroke, look for balance. Do they have an issue with balance? Do they have a loss of balance, maybe some unsteadiness or a lack of coordination when they're trying to walk? E is for eyesight. So are they experiencing double vision or blurred vision, or maybe they have no vision in one eye? When you're looking at their face, F is for face. Is one side of the face beginning to droop? When you're looking at A, you're looking at their arms, their legs. You're looking for their ability to extend their arms out in front of them and watching both arms to see if one arm drops down. Because if it does, that could be consistent with a stroke. S is for speech. Oftentimes people have difficulty getting words to come out or putting the words together so that it makes sense. Sometimes they just speak gibberish. And you'll pick up on that pretty quickly if they're trying to talk to you and what's coming out is making no sense. Finally, T is for time. Call 911 if you suspect a stroke. Better safe than sorry. Get them there within an hour, because there are fabulous interventions that exist now to be able to help someone with a stroke. They can use these catheters now that they can put up into the blood vessels of your brain. And if you actually have a clot up there, they can suck that clot out and potentially totally reverse your symptoms. So time is super important. Get them to a hospital. All right, so cardiovascular disease treatment. First and foremost, lifestyle changes are huge. Get out there, exercise for at least 30 minutes a day. Change your diet so that it includes heart-healthy choices such as low sodium foods, foods that have that are low in saturated fats. Pick more fresh fruits and vegetables to be included in your diet. Medication is available if we find that lifestyle changes don't help, or they don't help as much as your physician wants them to be able to help you, then there are medications that are available to control blood pressure, cholesterol, help with abnormal heart rhythms. So that's definitely an option. And then finally, there are medical procedures or surgery that's available. There are procedures to evaluate your heart arteries. That's called a cardiac catheterization. There are procedures to open blood vessels up. That's called stents, angioplasty. They also do coronary artery bypass grafting, or it's also known as open heart surgery. And then there are valve replacements that can be done if your valve's an issue. All right, so ConnectCare 3 is a employee and dependent benefit that's available. It is at no cost to you. You never see a bill for the services that are provided. It's a totally confidential service. Everything that's shared with nurses or health coaches is kept completely confidential. And it is a service that is independent from providers, meaning that we're not affiliated with, or we don't receive payments from hospitals, insurance carriers, or doctors. It's a totally voluntary service, which means that you need to reach out to us to begin working with us. All right, so how does the whole process work? First, a patient or you must reach out to ConnectCare 3, and then you'll speak with a patient advocate who becomes your first person to contact. And the patient advocate will do a brief intake assessment with you to get a better understanding of your needs. And then you have to fill out a consent form. And then those forms are pretty easy to follow. They take maybe 5 minutes to complete. And then once all the forms are submitted, then you will be assigned to the ConnectCare 3 line of service that best suits your needs. We do have a team of nurses. We have health coaches. We have a registered dietitian, and together they work to ensure that you get the service that you need, and they work together to meet your treatment goals and to get you to where you want to be. All right, so the services of ConnectCare 3 have really been expanding recently. Again, it covers employees and it covers dependents. And if you have a medical diagnosis that requires the care of a specialist, you can work with a nurse navigator. So some examples of a diagnosis or a condition that the nurses work with would be like orthopedic injuries or a cancer diagnosis, Crohn's disease, multiple sclerosis. There's a whole bunch of them out there, obviously. And the nurse navigators help by ensuring that the patients that they're working with they understand their diagnosis, and they also provide them with clinical research about their diagnosis and their treatment plan. And they do help with patients getting prepared for their physician appointments. They'll give them questions to take to the appointment. And sometimes we're even able to join a patient if it's a video conference call kind of situation, and we can listen and type up a summary to provide to the patient of what we've heard during that appointment. We also are working on or work with people through a chronic disease management program. And those folks that have diabetes, prediabetes, high blood pressure, high cholesterol, or obesity can enroll in that program. If you join the chronic disease management program, you'll work with a team that includes registered nurses, certified health coaches, a registered dietitian, and working with them to, receive education and guidance surrounding your essential dietary and lifestyle changes that are needed to control that chronic condition. So here's our contact information. Feel free to give us a call or to email us to get the process started. Thank you for joining us today. Have a good one.